Question 1, Prioritization, Airway versus Neuro Change. A 68-year-old male with a history of ischemic stroke 2 days ago is admitted to the step-down unit. The nurse receives the following assessment findings during handoff. Slurred speech, unchanged from baseline. Right-sided weakness, baseline. Oxygen saturation, 89% on 2L nasal cannula. New onset confusion and agitation. Respiratory rate, 28 per minute with shallow breathing. Blood pressure, 178/96 mmHg. Which action should the nurse take first? A. Increase oxygen to 4L via nasal cannula. B. Perform a focused neurological assessment. C. Notify the healthcare provider of hypertension. D. Reposition the patient to high Fowler's position. Answer: D. Reposition the patient to high Fowler's position. Rationale. Airway and breathing take priority. The patient is showing signs of hypoxia, low SpO2, tachypnea, confusion. Positioning is the fastest intervention to improve ventilation. Oxygen increase, A. is appropriate but comes after optimizing positioning. Neuro assessment, B, is important but secondary to oxygenation. Hypertension, C, is not immediately life-threatening compared to airway compromise. Question 2, Pharmacology, Insulin Timing Trap. A patient with type 1 diabetes is scheduled for breakfast at 0800. The nurse administers regular insulin, Humulin R, at 0730. At 0745, the meal is delayed by 1 hour. What is the nurse's priority action? A. Administer dextrose 50% for immediately. B. Give the patient a carbohydrate snack. C. Monitor blood glucose at 0800 and 0830. D. Hold the insulin dose documentation. Answer: B. Give the patient a carbohydrate snack. Rationale. Regular insulin onset is 30 to 60 minutes, meaning hypoglycemia risk begins soon. Since food is delayed, the patient must receive carbohydrates to prevent hypoglycemia. D50A is too aggressive and less symptomatic. Monitoring, C, is not enough. Documentation, D, is irrelevant to safety. Question 3, Cardiac, post-MI complication. A patient 24 hours post-myocardial infarction suddenly develops sharp chest pain worse on inspiration. Fever of 38.3 degrees Celsius 100.9 degrees Fahrenheit. Pericardial friction rub. What is the most likely complication? A. Reinfarction. B. Pulmonary embolism. C. Pericarditis. D. Cardiogenic shock. Answer: C. Pericarditis. Rationale. Classic triad, pleuritic chest pain plus fever plus friction rub pericarditis. Reinfarction presents with crushing chest pain. B. Causes dyspnea, not friction rub. Shock, D, involves hypotension and poor perfusion. Question 4, Electrolytes, hyperkalemia. A patient with chronic kidney disease has potassium of 6.5 milliequivalent/L. Which ECG finding should the nurse expect? A. Flattened T waves. B. U waves. C. Peaked T waves. D. Prolonged QT interval. Answer: C. Peaked T waves. Rationale. Hyperkalemia hallmark equals tall, peaked T waves. Flattened T, A, and U waves, B, are hypokalemia. QT prolongation, D. Relates more to calcium imbalance. Question 5, Infection control, isolation priority. The nurse is assigned the following patients. Which patient requires private room placement? A. Pneumonia with productive cough. B. MSA wound infection. C. Active tuberculosis. D. Influenza. Answer: C. Active tuberculosis. Rationale. TB requires airborne precautions plus negative pressure room. MSA, B, requires contact precautions but not necessarily private unless severe. Influenza, D, uses droplet precautions. Pneumonia, A, depends on cause. Question 6, OB, late decelerations. A laboring patient's fetal monitor shows late decelerations. What is the nurse's priority intervention? A, increase oxytocin infusion. B, reposition to left lateral position. C, perform vaginal exam. D, encourage pushing. Answer, B, reposition to left lateral position. Rationale. Late decels equals uteroplacental insufficiency. First action is improving perfusion, turn left. Oxytocin, A, worsens problem. Vaginal exam, C, not priority. Pushing, D, inappropriate. Question 7, Pediatric, dehydration severity. A 2-year-old presents with sunken eyes, dry mucous membranes, no tears when crying, capillary refill, 4 seconds. Lethargy. What is the severity? A, mild dehydration. B, moderate dehydration. C, severe dehydration. D, normal variation. Answer, C, severe dehydration. Rationale. Signs like lethargy, delayed cap refill, and absent tears indicate severe dehydration, requiring 4 fluids. Mild/moderate would not include lethargy. Question 8. Mental health, suicide risk. A patient hospitalized for depression suddenly appears cheerful and states, "I finally feel at peace." What is the nurse's best action? A, document improvement. B, reduce observation level. C, assess for suicide plan. D, encourage social interaction. Answer, C, assess for suicide plan. Rationale. Sudden mood improvement may indicate decision to commit suicide. Immediate assessment is critical. Documentation, A, and reduced monitoring, B, are unsafe. Question 9. Med-surg, post-op complication. A patient 1 hour post-op develops restlessness, tachycardia, hypotension, cool, clammy skin. What is the priority concern? A, pain. B, hypovolemic shock. C, infection. D, pulmonary embolism. Answer, B, hypovolemic shock. Rationale. Classic early shock signs, tachycardia, hypotension, restlessness, cool skin. Infection, C, develops later. PED, involves respiratory distress. Question 10, endocrine, Addisonian crisis. A patient with Addison's disease presents with severe hypotension, hyponatremia, hyperkalemia, weakness. What is the priority medication? A, insulin. B, hydrocortisone 4. C, levothyroxine. D, furosemide. Answer, B, hydrocortisone 4. Rationale. Addisonian crisis equals cortisol deficiency, life-threatening shock. Immediate steroid replacement is required. Insulin, A, may treat potassium but not root cause. Question 11, NGN, sepsis versus fluid overload trap. A 72-year-old patient with a history of heart failure, EF 30%, is admitted with pneumonia. Current findings. Temp, 39.2 degrees Celsius 102.6 degrees Fahrenheit. BP, 86/50 seconds millimeter of mercury. HR, 122 BPM. RR, 30 per minute. SpO2, 91% on 4-LNC. Crackles in bilateral lung bases. Urine output, 15 milliliters per hour. Lactate, 4.8 millimoles per liter. The provider orders 30 milliliters per kilogram for fluid bolus. What should the nurse do? A. Administer full fluid bolus as ordered. B. Hold fluids due to heart failure history. C. Administer fluids cautiously while closely monitoring respiratory status. D. Request diuretics before fluid administration. Answer: C. Administer fluids cautiously while closely monitoring respiratory status. Rationale: this is septic shock. Fluids are life-saving. However, heart failure creates a competing risk of pulmonary edema. The correct action is not to withhold fluids, but to titrate carefully while monitoring lungs, oxygenation, and signs of overload. Option A ignores HF risk. Option B is dangerous, untreated shock. Option D is inappropriate during hypotension. Question 12, NGN, DKA versus HHS differentiation. A patient presents with blood glucose, 620 mg per deciliter. pH, 7.08. HCO3, 10 milliequivalent/L. Positive ketones. K, 5.6 milliequivalent/L. Deep, rapid respirations. Which intervention is priority? A. Administer sodium bicarbonate immediately. B. Start insulin infusion. C. Restrict potassium intake. D. Administer oral hypoglycemics. Answer: B. Start insulin infusion. Rationale: this is DKA, acidosis plus ketones plus Kussmaul respirations. Insulin is the priority because it stops ketone production and lowers glucose. Bicarbonate, A, is reserved for extreme acidosis, pH less than 6.9. Potassium appears high but will drop with insulin, must monitor, not restrict blindly, C. Oral meds, D, are useless here. Question 13, NGN, chest tube emergency recognition. A patient with a chest tube suddenly has continuous bubbling in water seal chamber. SpO2 dropping from 96% 88%. Increased dyspnea. Subcutaneous emphysema. What is the nurse's priority action? A. Clamp the chest tube immediately. B. Assess for air leak in the system. C. Increase suction pressure. D. Remove the chest tube. Answer: B. Assess for air leak in the system. Rationale: continuous bubbling suggests an air leak, which can compromise lung re-expansion. The nurse must trace tubing connections. Clamping, A, can cause tension pneumothorax. Increasing suction, C, does not fix leaks. Removal, D, is not nurse-initiated. Question 14, NGN, stroke versus hypoglycemia trap. A patient suddenly develops slurred speech, left-sided weakness, confusion, vital signs stable. What is the nurse's first action? A. Activate stroke protocol. B. Check blood glucose. C. Administer aspirin. D. Prepare for CT scan. Answer: B. Check blood glucose. Rationale: hypoglycemia can mimic stroke. Always rule it out first because it is rapidly reversible. Activating stroke protocol, A, is important but comes after checking glucose. Question 15, NGN, medication safety, heparin. A patient is on a heparin infusion. Lab results: APTT, 110 seconds, therapeutic, 60 to 80. Platelets, 85,000/mm superscript 3. Hemoglobin stable. What is the priority action? A. Continue infusion. B. Stop heparin infusion. C. Administer protamine sulfate immediately. D. Increase infusion rate. Answer: B. Stop heparin infusion. Rationale: APTT is critically high plus platelets low possible hit risk. First step is to stop heparin. Protamine, C, is used for bleeding, not just abnormal labs. Question 16, NGN, postpartum hemorrhage. A postpartum patient, 2 hours after delivery, has heavy vaginal bleeding, boggy uterus, BP, 88/50 millimeter of mercury, HR, 124 BPM. What is the nurse's first action? A. Administer oxytocin. B. Massage the fundus. C. Start 4 fluids. D. Call rapid response. Answer, B. Massage the fundus. Rationale. Cause equals uterine atony. First action is fundal massage to stimulate contraction. Oxytocin, A, follows. Fluids, C, are important but after addressing cause. Question 17. NGN, AKI versus chronic kidney disease. A patient has sudden decrease in urine output. Creatinine rise from 1.0 to 3.5 in 24 hours. Recent contrast CT scan. What is the likely diagnosis? A. Chronic kidney disease. B. Acute kidney injury. C. Nephrotic syndrome. D. Glomerulonephritis. Answer, B. Acute kidney injury. Rationale. Rapid creatinine rise after contrast equals contrast-induced AKI. CKD is gradual. Others don't match acute timeline. Question 18, NGN, ventilator alarm priority. A ventilated patient triggers a high-pressure alarm. Assessment shows agitation, thick secretions, decreased breath sounds. What is the nurse's first action? A. Increase ventilator pressure. B. Suction the airway. C. Sedate the patient. D. Call respiratory therapy. Answer, B. Suction the airway. Rationale. High-pressure alarm equals airflow obstruction, secretions, biting tube, kink. Suctioning resolves obstruction. Increasing pressure, A, worsens injury. Question 19, NGN, delegation trap. Which task is appropriate to delegate to a UAP? A. Assess pain level in post-op patient. B. Assist stable patient with ambulation. C. Evaluate effectiveness of medication. D. Teach insulin administration. Answer, B. Assist stable patient with ambulation. Rationale. UAP handles stable, non-assessment tasks. Assessment, A. Evaluation, C. And teaching, D. Require a nurse. Question 20, NGN, priority lab interpretation. A patient's labs. Sodium, 118 milliequivalent/L. Potassium, 4.2 milliequivalent/L. Calcium, 9.0 milligrams per deciliter. Patient is confused and lethargic. What is the priority intervention? A. Restrict sodium intake. B. Administer hypertonic saline. C. Encourage oral fluids. D. Monitor only. Answer, B. Administer hypertonic saline. Rationale. Severe hyponatremia, less than 120, with neuro symptoms equals medical emergency. Requires 3% saline cautiously. Fluids, C, may worsen dilution.
If you made it through questions 120, you've already stepped into high-level clinical reasoning territory. The exact mindset the Nclex is designed to test. This isn't about memorizing facts. It's about prioritizing under pressure, recognizing traps, thinking like a safe entry-level nurse. And if you caught the correction in question 1, good. That's how you sharpen your edge. We're just getting started. The next set gets even more intense. multi-patient scenarios, SATA traps, and critical decision-making. Subscribe and follow MCQs Master 101 for more advanced Nclex breakdowns, deep clinical scenarios, and real exam-level practice.